welcome to the deep dive.
Glad to be here.
We're jumping right into a stack of sources you sent us, all focused on a really critical topic, cancer survivorship.
That's right. Beating cancer is, it's monumental. But these sources, they make it crystal clear the journey doesn't just stop when treatment does.
No, definitely not. Life after diagnosis has its own, unique hurdles, and it requires specific kinds of care, long-term support.
Which often gets overlooked, I think.
Exactly. So our mission today is to really unpack what these sources, articles, guides, studies tell us about what it's like being a cancer survivor now.
And also look at the strategies, the programs being developed to help people through this ongoing experience.
We've got a real mix here, programmatic guides, very personal stories.
There's a study on survivor challenges and a deep dive into physical activity, which has some surprising angles.
Yeah, it does. So let's see what insights we can uncover. All right, let's set the stage first. The survivorship journey itself. Several sources, especially the NPR piece and that UAMS study, they really stress something important.
Which is?
That life after the diagnosis can be incredibly tough. Sometimes, honestly, more challenging than the treatment phase itself.
That's a powerful point. It challenges the idea that once treatment's done, you just bounce back.
Right. The NPR source talks about how cancer's effects can linger, reshaping life for years, maybe even decades. It's not just a blip.
It's a long-term reality, and that's why this idea of structured survivorship care, like what's detailed in the ICCP program guide, becomes so crucial.
Yes, that guide shows how you can build, formal pathways for care.
Yeah.
Right from the diagnosis moment.
Yeah, it lays out these specific routes. Pathway 1, you're eligible, you consent to treatment. Pathway 2, eligible, but maybe you opt out.
Or Pathway 3, not eligible for curative treatment, so maybe palliative care comes in. It guides people early on.
It's about getting them into the right stream of care. And it even covers the admin side, like doctors notifying a cancer registrar. It's all part of tracking and supporting people.
And for those diagnosed through screening, like the programs mentioned in that ICCP guide, patient navigation is key, getting them connected.
It really highlights the complexity, starting right at diagnosis and moving forward. Now, thinking about that initial phase, even before treatment starts, the sources point out some vital steps, especially if patients need to travel for care.
Like the ICCP example mentioned, people needing off-island referrals from the Marshall Islands to, say, Hawaii or Manila.
Exactly. That's a huge disruption. Preparing patients for that is critical.
So the case manager's role there is key, pre-departure, giving education about the cancer, why treatment's important, the referral process.
And crucially, what support will be there when they return. It's not just sending them off.
And the guide suggests something I thought was really insightful, having the patient meet another survivor before they leave.
Peer support, right from the get-go.
Yeah, get that lived perspective. And receiving a practical treatment travel packet from a support group, that goes beyond just medical facts.
Addresses the emotional, the practical, underscores that peer value early. Okay, so let's shift to the longer-term experience, the challenges survivors face.
Right. The UAMS study you sent gives a powerful look at this, especially for diverse rural survivors. In Arkansas, this one.
And the main finding, it's really eye-opening.
It is. The primary challenge wasn't physical side effects. Those were there. It was overwhelmingly psychosocial challenges.
Nearly half, 48.4% of participant responses. That's huge.
It tells us that while we focus so much on the physical fight, the ongoing battle for many is internal, emotional, mental.
Listen to this quote from that study. It has changed me completely. I'm no longer the happy person I once was. I do not like how it makes me feel emotionally, physically. It just hits hard.
It really does. And the study found the surprising nuance, too. Some survivors felt guilt, shame, even, for not having chemo or radiation.
Guilt for not having the harder treatment. Wow.
Yeah, one person shared, I feel ashamed when I have to tell people I didn't have to do that. It makes me feel very guilty. There's this weird pressure, maybe.
A pressure to fit a certain cancer narrative. That's tough. The NPR source adds more layers here, too, through those personal stories.
Right, feeling robbed of youth, always living in the shadow of the disease.
And for those diagnosed young, like E.J. Beck at 10, Brendan Harley at 17, the impact on their development, schooling, psychology, it can last decades.
And it gets into really personal areas, too. Stuff not always discussed in the clinic, like dating, sex after cancer, Delta James, Abigail Glavey. Their stories show how cancer just reorders relationships, body image.
It makes everything more complex, which leads us perfectly into why having a clear plan after treatment is so vital. Survivorship care planning.
Yes. The SCP? The ICCP guide really highlights this as a crucial document, like a personalized roadmap for life post-treatment.
And it spells out what needs to be in that roadmap. Treatment details, future checkups, potential long-term effects to watch for.
And ideas for improving health. It needs that treatment summary and the follow-up plan. Two key parts.
The goal is getting these to patients diagnosed or treated in the past year. Ideally, the treating hospital provides it.
But the reality, like in that RMI example, is patients often come back without one. So local providers have to step up.
They have to create the SCP using whatever info they can get, like treatment summaries from the referral office.
So the process involves getting follow-up sorted with the local doctor. And if that doctor isn't in this special provider network...
Yes, the provider network. Tell us about that.
It's a group of doctors, nurse practitioners, who've done specific training on survivorship care, like through an e-learning series, maybe from GW Cancer Center I mentioned.
So building local expertise.
Exactly. And members of this network then handle the ongoing care, follow-up, screening for recurrence, symptom management, referrals, communicating the plan.
Makes sense. And the case manager, or whoever coordinates care, pulls it all together, gets the summaries, sets appointments, makes copies of the SCP.
Helps the patient stick to the plan, yeah. There's even a guideline for providers on how to run that SCP visit, educating patients on warning signs, identifying late effects.
Proactive symptom management. It's about looking ahead.
Okay, so moving from planning to managing those lingering issues, the physical side effects. The UAMS study put those high to almost 40% of responses focused there.
And this is where that other source, the one on physical exercise, gets really interesting. It frames exercise not just as good advice, but almost like a targeted therapy.
Like a drug treatment, it said.
Yeah.
With specific prescriptions, type, frequency, intensity.
Exactly. And it details how exercise can tackle specific nasty side effects, like bone loss, often from treatment itself.
Yeah, hormonal therapy, chemo.
Right. Weight-bearing exercise is presented as a key lifestyle change to prevent that loss, keep bones healthy.
Or muscle loss cachexia, which is serious. Or that unwanted weight gain after some treatments, which links to higher risks later.
Exercise helps reduce fat mass, lower those cardiometabolic risks, and potentially prevent cachexia.
What about neuropathy, that nerve damage from chemo? Tingling, numbness, balance problems.
Yeah, CIPN. The source highlights exercise as safe and effective. It can reduce symptoms, improve balance, strength, walking speed, maybe even helps nerves regenerate.
Balance training specifically mentioned as promising.
Yeah. And lymphedema, that swelling risk, often after lymph node removal, lifelong risk.
Common after breast cancer surgery.
Right. Exercise, including resistance training, even in the affected limb, can help. It increases lymphatic flow, so it's both preventative and therapeutic.
That's counterintuitive for some, maybe, exercising the affected limb.
It used to be, but the evidence suggests it can be safe and beneficial when done right. And then there's pain. Huge issue.
From the cancer treatment, surgery.
All of it. Exercise can actually elevate pain thresholds. Exercise-induced hypoalgesia, it's called. It works biologically. Good effects shown for chronic muscle pain, neuropathic pain. Needs personalization, sure, but the potential is there.
Okay, so strong evidence for the physical side. You said it connects back to the psychosocial too.
Absolutely. That's where it gets even more compelling, I think. Take cancer-related fatigue. CRF.
For that crushing exhaustion.
Yeah, affects 70–80% during treatment, maybe a third of survivors long-term. Exercise is shown as feasible, safe, and effective for managing it, sometimes combined with things like yoga.
Beats just telling people to rest more, which often doesn't help CRF.
Exactly. And sleep problems. Insomnia. Very common.
Exercise improves sleep duration, quality, helps you get more deep sleep, fall asleep faster. It impacts our internal clocks, body temp.
It's a solid non-drug approach. And then depression and anxiety, huge impact on quality of life, right? Even treatment adherence.
Exercise influences brain chemistry, mood regulation, serotonin, endorphins. It reduces negative feelings, boosts mastery, hope.
The source even mentions it can be as effective as some antidepressants, like sertraline, and maybe the effects last longer. Plus, it helps with anxiety, too.
Wow, as effective as medication.
Potentially, yes. And finally, quality of life, self-esteem. Cancer changes your body, your self-image, hair loss, scars, weight changes.
Exercise improves that physical self-concept, helps people adapt, feel more capable in their bodies again.
So the benefits are really broad. Physical, psychophysical, psychological.
Okay, the case for exercise seems really strong. But People face barriers, right? The source acknowledges that.
Oh, definitely. It's not as simple as just saying, go exercise. The barriers are real. Lingering illness, pain, fatigue.
Practical stuff, too. Cost, time, getting there, childcare.
All of that. Plus individual things. Lack of motivation, low confidence, feeling isolated, maybe just feeling too busy or overwhelmed.
And that old idea that you should rest when you have cancer. Fear of making things worse.
Right. But here's the encouraging part. Despite all that, the source says about half of survivors are still interested and feel capable of exercising.
So the motivation is often there, underneath the barrier.
Exactly. Which means finding ways to make it accessible is key. The sources suggest strategies, encouragement, counseling, motivational interviewing from doctors, physios, trainers.
Educating patients on how to do it safely. Maybe supervise first sessions to build confidence.
Yeah, showing correct form. Using trained professionals, encouraging people to track their activity and symptoms themselves.
It is an agency.
Right, and promoting social connection, exercising with a partner or in a group. That helps motivation hugely.
And the ICCP source kind of ties into this, mentioning a physical activity program that needs medical clearance first, integrating it formally.
Shows it's being seen as part of the plan. But exercise isn't the only support, of course.
No, the ICCP guide detailed other important systems too, like a dedicated cancer support center.
Yeah, a hub. Offering information, resources, group support sessions on a regular schedule.
And specific programs too, like that art therapy program.
That sounded really interesting, targeted at recent survivors, right?
Yep, within the past year. Runs twice a week, small groups, set duration.
And the topics covered. It wasn't just about art techniques. It was about dealing with emotions, anxiety, fear, finding happiness, gratitude, hope.
Using painting, collage, journaling, even providing materials to continue at home. It sounds like a really thoughtful way to address those psychosocial needs creatively.
Absolutely, a nonverbal outlet for processing complex feelings.
The guide also mentioned nutrition classes. Practical stuff on healthy eating, cancer-fighting foods, local cooking.
Addressing long-term wellness. And referrals to other clinics too, right? For things like diabetes or help quitting smoking.
Yeah, recognizing survivors are whole people with other health needs beyond just the cancer follow-up.
It's that holistic view again.
Okay, let's try and unpack all this. We've gone pretty deep today into what survivorship really means, beyond the medical side.
We've seen structured care models, looked at those really profound personal and emotional challenges.
And the impact of things like exercise, art therapy.
Yeah.
Things that support the whole person.
I think the core thing weaving through all these sources is that survivorship isn't an endpoint. It's a continuous journey. It's multifaceted.
And it demands support that's holistic, not just physical health, but mental, emotional, practical, social.
So what this tells us, I think, is that while the doctors fight the disease, effective survivorship care has to be broader, personalized, accessible.
It has to recognize those diverse, sometimes hidden struggles people face for years after treatment ends.
Yeah. This dive into the sources really highlights how vital dedicated programs, trained providers, and tailored support systems are. Not just for coping, but for helping survivors actually thrive.
So, thinking about everything we've covered, the plans, the challenges, the different kinds of support, what stands out most to you from this deep dive?
And maybe we can leave you, the listener, with this thought.